The crumbling healthcare system of Afghanistan, a silent humanitarian catastrophe. Afghanistan, a nation already grappling with poverty, conflict, and disease outbreaks, now faces a looming humanitarian crisis of unprecedented scale. The abrupt halt of U.S. aid, a decision that reverberates through the country's fragile healthcare infrastructure, has left millions vulnerable to preventable diseases and death. The consequences are stark and deeply disturbing. Over 200 World Health Organization, WHO, facilities, lifelines for 1.84 million Afghans have been forced to close their doors, effectively silencing the vital hum of medical care that once pulsed through their communities. This isn't a mere inconvenience. It's a catastrophic failure of global responsibility, leaving a trail of suffering in its wake. The catalyst for this devastating collapse? President Donald Trump's sweeping executive order in January, freezing all U.S. foreign assistance, a staggering $40 billion, £32 billion, effectively pulling the plug on the lifeblood of numerous international projects, including those vital to Afghanistan's survival. The impact on USAID programs has been devastating, with over 80% facing cancellation. This is not merely the curtailment of funding. It is the systematic dismantling of healthcare networks, jeopardizing the health and well-being of an entire population. In Afghanistan, this translates to a chilling reality. In 28 out of 34 provinces, health clinics have fallen silent, leaving gaping holes in a system already struggling to cope. The WHO rightly labels this an escalating humanitarian crisis, one that threatens to overwhelm a nation already teetering on the brink. Measles, malaria, and polio, diseases long battled against, are poised to make a devastating resurgence. The specter of malnutrition, a silent killer that steals away lives slowly and cruelly, looms large, threatening to deepen the suffering. The tragic irony is that Afghanistan was already battling a rise in polio cases, hampered by the Taliban's restrictions on vaccination programs. Now, with the closure of WHO-run facilities, the obstacles to preventing these diseases have become insurmountable for many. The lack of access to vaccinations, maternal and child health services, and basic medical care leaves the most vulnerable women, children, and the elderly exposed to preventable suffering and death. The desperate pleas echoing from Afghan communities paint a picture of profound despair. Abdul, a representative of the affected population, describes heartbreaking appeals from communities reaching out to healthcare workers, pleading for the reopening of clinics. Religious leaders and tribal elders, respected figures in Afghan society, have become messengers of this urgent plea, desperately seeking a lifeline for their communities. Their voices, choked with worry, highlight the sheer desperation of the situation. They are not asking for luxuries, they are begging for the basic right to health care, a fundamental human right tragically denied. The consequences of this aid cut extend far beyond immediate health impacts. The closure of these facilities fuels instability, further weakening a nation already struggling with conflict and displacement. It undermines decades of progress in public health, pushing Afghanistan back into a dark age of preventable diseases and suffering. The economic fallout will be equally devastating, as families already struggling to survive are now confronted with the additional burden of catastrophic healthcare costs. This is not just a crisis for Afghanistan, it is a global crisis of conscience. The world cannot stand idly by while a nation crumbles under the weight of preventable suffering. The urgent need for international intervention, beyond rhetoric and statements, is undeniable. We need decisive action, immediate funding, and a recommitment to the fundamental right to health care for all, regardless of geographical location or political climate. The silence of inaction is as deafening as the cries for help echoing from the closed doors of Afghanistan's health clinics. The lives of millions hang in the balance. The time for decisive action is now, before this silent humanitarian catastrophe claims even more lives.